I'm Kristen Daniell, and I'm a makeup artist in Houston, Texas. I work a lot. I'm always on the go. I like to work out. I like to shop, run, cook. Probably the first symptom that I noticed I didn't really realize was a symptom of having a brain tumor was my migraine headaches. And about a year and a half ago, they started getting worse. And within that same week that I noticed that they got a lot worse, I was actually working at my studio and went paralyzed on my whole right side of my body. And so I went to the ER, and they ran all these tests, and that's when they told me that I had a tumor that was benign, most likely, and that had been there for like 10 to 15 years. So yeah.
I got the call that afternoon that Kristen had a brain tumor and was being taken by ambulance en route to Methodist Hospital.
The tumor was located on the top left side of my brain, which is why they think that that was having to do with me going paralyzed on the right side of my body, because it was in the motor skills area. And it was the mass of a tennis ball, but it was on top of my brain. It wasn't actually in my brain.
You look at it on a scan, it looks pretty big. It's pretty threatening, it's pretty ominous. Scary situation. Not only is she going to lose the function on one side, but because it's on the left side of her brain, she's going to lose her speech. So it's a pretty tense, scary situation, not only for her, but for all of us.
When they first told me, I was in shock. I mean, even from the point that I went paralyzed, it's just kind of that, like, what is happening, After they told me that I had the tumor, the next thing I remember is at the ER, they told me we have a room for you at Methodist Hospital, and Dr. Baskin's gonna be your surgeon, and he's like the best of the best.
So Kristen's case was absolutely incredible. This young woman in the prime of her life comes in starting to lose function on one side of her body. Why? Because she has this very large tumor growing on the lining of her brain, compressing and distorting and pushing her brain inward, causing the brain to stop functioning.
I first met Dr. Baskin when I was in my daughter's hospital room. He walked in and introduced himself, and I immediately felt very confident. And I knew he had a very good reputation, and just within a few words, I knew that we were in the best hands possible.
We don't want to just operate on the tumor, because if we cut into the tumor, as we have to, it will bleed. So we actually do an angiogram where we inject dye into the blood vessels of the head. We find out where all the vessels in the tumor are, and then we thread a little catheter up and shoot particles into the tumor and clot off the blood supply. So you've taken this very angry vascular tumor that's going to bleed, and you've knocked it down to a half-dead mass even before you start the surgery.
There was a nurse in the basement right before I had my first MRI, and she was shaving little sections of my hair, and she was putting the pieces of hair in the trash can in front of me, and she was like, "Do you want me to move this trash can behind you so that you're not watching these long pieces of hair go into the trash can?" And I was like, "No, I'm okay, it's fine. And besides, I know God has my back." And so she just like sat there really quietly for a while, and then a few minutes later, she was like, "Something that you said really struck a chord with me. You said that God has my back, and you're exactly right." She's like, "I'm gonna write that on your surgery cap if you don't mind, and you can wear it whenever you go into your surgery." And I was like, awesome. That was kind of a neat moment for me.
And we used 3 very important technologies to beat this tumor. The first is the microscope and the microdissection and the micromanipulators, the way that we have to go into the brain and generally dissect around brain tissue and preserve function. The second is a virtual reality system. We need to know exactly where we are in the brain with accuracy. So we have this system where we register the system to the patient's head and the MRI scan, and then during surgery we can touch any spot in the brain and see where we are on the MRI scan with 1 millimeter accuracy. The third technology that we used in her case is ultrasound. We got this big mass. We don't want to pull it off the brain. We can injure the brain. So we take this little probe, send 10,000 cycles per second into the tumor, shatter the tumor, core the tumor like an orange, so there's just a little rind, and then we can peel the rind away from the brain. So we opened the skull in a way that gives you a wonderful cosmetic appearance, did all this work, put it all back together, and she had a wonderful result.
I went back in for my follow-up MRI, and we were looking over the results, and he just kept flipping back and forth, and he's like, I don't see anything. and I mean, I was just like in shock. But I knew that it wasn't going to be there, like in my mind, but just to actually see that there was nothing left on those MRI results and to see the before and the after, it was just crazy. I'm totally recovered now. The tumor is completely gone, and I am better off than I was before because I don't have any migraines. And I can do anything that I could do before. All my motor skills are back. I feel 100%, so I'm totally healed.